Tissue, rat tooth, forceps.
Tissue, rat tooth, forceps. 1,
1, 2, 2. Dressing plane, forceps.
dressing plane, forceps. 1,
1,
2,
2. Adson, forceps.
add some forceps. 1,
1,
2,
2. DeBakey, forceps.
the baking forceps. 1,
1,
2.
2. Army Navy retractor.
Army Navy retractor. 1,
1,
2.
2. Wheatlander retractor.
Wheatlander retractor. 1,
1. Richardson retractor.
Richardson retractor. 1,
1,
2.
2. Full suction.
Full suction with guard. 1,
1. Yanker tonsil suction.
anchor tonsil suction. 1 with tip.
1. It's complete. Count.
Count is complete. So you want to knock the account out first. That way, what does the circulator have to do now? What's the last lesson?
Notify.
What?
Correct.
Skin prep, right?
Skin prep.
Very good.
This is ready.
How about the mayo stand?
All right, now we're going to make our surgeon's present. What went into that? Everybody remember? The surgeon's present, bucket of junk.
The light handles?
Light handle.
Oh, okay.
Bovie and scratch pad.
Some free time?
Can't go.
Staples?
What is that green thing? HM1.
Suction tubing?
These are
What is that?
light handles.
Oh, light
Kind of
handles.
push them out. There you go. All right, there you just flip them on.
Okay.
Okay, you cover that all up. And you top it off with a bow. 2 rings.
Little ribbon.
2 rings. What goes in it? Does that say so? Right. When do we use the stapler?
At
At the very end, right? So we're not gonna have to worry about
Are
that.
those disposable?
Yes, so it's disposable. The specimen comes, that's gonna be for a circulator when the specimen comes out, right? Yes. Yeah, okay. Last strap that's gonna go on the patient is the
Lab.
last strap. So you want that all the way on the bottom.
Got it right.
What goes in the middle?
Towels.
Towel, all right. These are pre-made hand towels. Verify with your surgeon whether or not they want these. Tell you right now, me as a surgeon, I don't want them. So you won't tell. And how do you go?
3, 2,
3, 2, 1. 3, 2.
So when you're making these, make sure that nothing falls over the edge of the table.
So that would be that.
Cute.
3, 1. 3, 2.
Oh, wait.
Now I like doing the little triangle slim. That's just me. Maybe I always need your clock glass with that, so you might as well put them on top.
Oh, yeah.
How many?
And the first thing I would put on the patient,
The tray?
the half sheet.
Oh,
Foot tray.
half sheet.
Right.
Half
What else
sheet.
am I gonna need?
The surgeon's
The
gown.
gown. So first you put down the gloves, then the gown, and a gown, in the order that he's gonna use them.
While you're doing this, is the circular allowed to do skin prep while you're filming this?
The only thing that you need the circulator for
Does it count?
is the count. That's why we like to knock that out first.
I see.
All right, next, I'm gonna need my mayo stand. That circulator, please remember that. Just move the mayo stand over to the left side of the back table before you get started with anything.
It's missing a lid.
And then that patch stand you can use to prep your patient, right? Oh, you only have one?
Oh, yes. Then it becomes control table.
Other side.
Oh, this is right here.
Left side.
This you're gonna put it, you're gonna set it up for the skin prep, you can put that back there.
So unfold it, slip your hands in there, look for the other fold, kind of grab that. Open up the mouth. You're gonna eat the mail.
Bro, I eat the mail.
You're gonna eat the mail. So this acts as your cup. Remember what I said? You always have to cup your hands, right? Because you don't want to accidentally contaminate it. One of the methods is that you pull the whole drape out and slip it on. Probably the easiest method. Make sure your foot is always on the bottom of the lampstand so it doesn't run away from you. Now the lampstand is the only thing that's also sterile on the bottom.
6
So I can grab
inches.
this anywhere basically. Because this is going to sit on top of the patient, right?
Yes.
On top of the drape, so that's why everything is sterile. It's the only exception to the rule. Go ahead and grab a towel. Place that on top of it. Then you want to make sure that you tuck everything in. You don't want anything hanging off. That just gives you space to get caught with your instruments. Poke holes into it. If there's a hole in it, what happens? Everything. Exactly. So you want to work that. So make sure you check everything. Then flip the mayo stand around. Make sure you don't get a broken one. So the spine's towards you. And then you want to set everything up on the left side of the mayo stand. Okay? Spine towards you, left side of the mayo stand.
Does it matter that, is that?
The circulator can fix that. So you can pull that down a little bit.
No, it's still in
You
there.
can.
I'm sorry.
You gotta watch out.
Does it matter if that touches that? Mayo stand touches the bottom of that?
And 6 inches below.
When the circulator's pulling this down, don't go like this, because where's my head right now?
Sterile fields.
So you gotta bend down and then uncuff it.
Ay, ay.
Everybody have their sheet? Everybody knows what goes on the mayo stand, right? We'll run all 4 Kelly's curve. Make sure that you clamp them all before you put them on here. Should all be clamped once after. 2 straights. Two peons.
Wasn't the second one?
Peons should be loaded with the kidney. Peanut, whatever you want to call it. Should be about at the halfway point. Okay? Another way to load these is if you grab both of the end pieces and squeeze it together. So if you're not really sure, make one of each and the surgeon will tell you which one you like better. But you have to have a nice little tip, because that's how we dissect soft tissues, okay? Right, 2 cokers. Two Alice clamps and 2 back pops. And you have your right angles. On those right angles, so that's where your free ties come in. Just to keep your free ties a little bit more organized and you don't lose any of them, use a hand towel. Flip it open once, doesn't matter which way. Open it up. Grasp the end of it. Pull it out. Lay it in there with one end hanging out. Close it. Pull it. There you go.
Oh, okay.
Alright, that way you just have them hanging out. You can leave them on your mayo stand like this. That way when you need to reload these, you just pull one out.
Oh,
And ready to go.
That is.
So you'll have one back loaded where it's coming out of the back,